Hi, I'm Dr. Ed Laskowski, co-director of Mayo Clinic Sports Medicine, and I'd like to invite you to my lecture at the World Congress on Sports and Exercise Medicine in Dublin, Ireland. This conference is going to be on November 3rd and 4th this fall, and my lecture is going to be entitled How to Keep a Baby Boomer Buff, Activity as We Age. There's a lot of physiologic changes that occur as we age, and we lose lean muscle mass as we age, we lose aerobic capacity, our connective tissue gets a little tighter, less elastic, we have a tendency to fall more. That's all the bad news, but I'm going to also give you the good news that many of the effects of aging that we encounter just as a normal fact of life and fact of aging can be combated by activity and exercise. With exercise truly is a medicine. And for an example, that lean muscle mass, we lose about 10% of our lean muscle mass per decade after age 30. We can get that back and we can restore that. We have to work at it, whereas when we're younger, our metabolic processes and our metabolic rate is such we don't have to work on it as much. But we can, by training, we can restore that lean muscle mass. Because if we don't, that lean muscle mass is replaced by fat. And we know the problem now with our world obesity epidemic. So that's an example of how we can combat it. Our aerobic capacity doesn't have to decrease that much if we train regularly. So we'll show you the recommendations for training and aerobic activity to keep our heart healthy and also for optimum function and status and everything. Strength training, hugely important, but the way you do it is even more important. Proper technique is key. It's not practice that makes perfect, it's perfect practice that makes perfect. And what we want to show you is perfect practice, because I, in my practice, see a lot of people who hurt themselves with strength training and with weight training activity. So I want to give you the proper guidelines and the proper technique issues to consider when you do strength training exercise. Flexibility, also very important. We find that as far as everybody's genetics is a little bit different and everybody's flexibility may be variable, but we want symmetry side to side for sure, because we know that's injury protective. So, and the final thing, we think of aerobic training, we think of strength, we think of flexibility. There's one more that's in addition to those, is stability training. Because you can be very strong, but not stable. You can be very flexible, but not stable. You can be very aerobically fit, but not stable. So you almost have to train stability training in a separate fashion. And we'll show you how to do that, especially after injury. And we have another saying, pain-free doesn't mean normal. You may have an injury, you may have recovered for a while, you may have healed, and say, oh, I'm okay. But maybe not. Unless we've restored the strength, the flexibility of the tissue, and the stability of the system, we're going to be at risk for other injuries. So we'll go over all those things. We'll talk about how physiology changes as you age, but we'll also talk about some of the incredibly elite performances that people are having now into older age with adoption of these training techniques. We'll take you through every step of the way, through every training technique to optimize your status and also your patient's status. Love to see you at Dublin, Ireland, November 3rd and 4th at the World Congress of Exercise and Sports Medicine.